G'day everyone, I'm Alex.
Hi, I'm Eva.
Eva, we're going to have a chat today about our work, but why don't you start by telling me a bit about yourself?
So I'm Eva, as I said, I'm from Austria. I'm a Rotary Peace Fellow. I graduated from Chula in Bangkok 2017. And originally I'm a medical doctor and also have human rights background. And I live and work in Austria, and currently I work for Caritas Austria. I'm a project manager for Ukraine. And besides my work, I voluntarily have a global grant project in Burundi. And what about you, Alex?
Amazing. Yeah, well, my name's Alex. I'm from Australia and Aotearoa, New Zealand. But currently I live and work in North Carolina, and I work supporting the teaching of the current Rotary Peace Fellows as they explore topics around peace and conflict. So I teach at the University of North Carolina as a professor of the practice, and I teach a course called the Theory and Practice of Conflict Transformation. I'm also a Rotary Peace Fellow. I graduated in 2024 from the Duke UNC Rotary Peace Centre, and I love being connected to the Rotary Peace Centre and to the work that Rotary is doing, especially as the new fellows are coming up and emerging. So I want to ask you a question. Let me start with this one. You and I are both saying, although we come from different perspectives and different frameworks, but we're both saying in our distinct fields that well-being and peace are intimately connected, and that they're actually an inseparable aspect of peace building and sustainable change. When did you first realize that in your journey as a peace builder?
I first realized that when I was running a small NGO where we treated people without health insurance. We had very marginalized groups coming to us. Those were homeless people, drug addicts, poverty migrants, we call them, refugees. So those were people who had no money, no health insurance, and didn't speak the language, and had a very hard way to get health care, first of all, and to find their way in the public health system in Austria. And for them, it was a high stress, and they could not be as healthy as our Austrian population because they didn't have the same chances. And it's a big hurdle for them. It's a big stress for them. They cannot work as well as other people do. Also, as a doctor, you get so many people sitting in your practice. We had patients from 80 different countries, so that is also a very connecting element as a medical doctor, that you treat everybody equal. So that's also a beauty of the profession.
Yeah, I can relate to that. I think about some of my previous work experience on front lines or working in direct social work populations, and seeing the limits of the approach that only focuses externally, when actually the well-being and experience, mental health of the practitioner themselves is also really important. So we are encouraging people to be healthy, but mental health and well-being is a really important part of that. And actually, we really can't separate inner work from outer responsibility. These things go hand in hand. They're inseparable parts of the peace building process. And when we support the populations and communities that we work with to be really healthy, we're also starting from that place ourselves too, and engaging with people in a really aligned way that supports peace building practitioners to deliver their best work in service of the communities and people that they work with.
Now, let me switch to another topic, your current teaching job. You are teaching current Peace Fellows at Duke UNC. So what do you see in the new Peace Fellows, and what do you see also as potentials and challenges coming up in the education of future peace builders?
Right, yeah, it's a great question, because I think we're at a really interesting time in peace building education. There has been for many, many, many years a very strong focus on the more technical aspects of peace building work. We could think of those as things like policy development, program implementation, monitoring and evaluation. And these parts of peace building are incredibly important and form a really important bedrock of how we deliver peace building interventions globally, locally and globally. But something that's often been missing from peace building education is this idea that the best work that we deliver externally starts with ourselves. So we can think of that as inner work being intimately connected to social change. So one of the areas of focus that we have in the curriculum that I teach is supporting practitioners to develop their own self-awareness, to develop a strong understanding of their own identities as peace builders, and to think about this concept of transform yourself to transform the world. So in that sense, we start with the practitioner and we scale up and we scale out over time. it can be really problematic thinking that we can work on conflict only external to us if we don't have any of the skills to support our own internal conflict resolution or interpersonal conflict resolution.
Totally agree.
So Rotary Peace Fellows are incredibly skilled in many of the technical aspects, and part of what we're doing is re-grounding them back in their own experience, who they are as practitioners, the identities that they bring to the work, the multifaceted ways that they engage with communities, but starting from the self. Inner work and outer work are inseparably woven, and that's a core focus of what I teach. So now, let me turn to you, Eva. You and I have both seen in our work that there is a tendency in peace building to treat health and psychological well-being as add-ons. Important, but not always the first place to start. How can we push back on that narrative, and what's our strongest argument for why health and well-being are actually fundamental rather than just secondary?
It actually totally builds up on what you just said. In reality, it has to start with yourself, but I'll start from the medical perspective. So if you're not mentally well, if you're not, let's talk about mental health, if you're not stable, then you will react not in the most perfect way. You can't control your emotions. You might get annoyed quickly, same as you haven't eaten or you didn't sleep well or you're having big pains. So if you're physically not well or mentally not well, you might not react and control yourself in the best way, and that might lead to more aggression than necessary. And also, secondly, if you're not healthy, if you don't have a healthy body, you also cannot contribute as well to society, which might also be a burden on society and on yourself, which might make you not feel worthy. And also, if you really have another type of mental health disease, that can of course also hinder you in participation if somebody is very depressive and cannot even move out of the bed. So those are cases where mental health is really intricately connected with peace. And also it has to do with reconciliation. So for a reconciliation process, it's very important to be stable yourself, to first start with your inner healing and inner reflection. It's very difficult for those people coming from war backgrounds to do that reconciliation process with people they fought before. So first of all, they have to be well themselves. And actually, I think this is what you were saying before. So now I want to actually give the question back to you.
Yeah, I think it's a really interesting way to frame the work, that rather than all of these separate elements, that actually all of the elements of peace building are interconnected. And when we intervene in a system in one part of it, it's not isolated to the way that the other things are also impacted. So rather than thinking of either or, like or health or peace building or ending wars or health, actually we can think of this as a really multifaceted approach. We have to approach this problem from all different dimensions. And when we intervene in the system, there are ripple effects to other parts of that system as well. You know, one of the phrases that I really like and that anchors my teaching and my own theory of change is a quote from Bill Bryan, which is, "The success of any intervention depends on the interior condition of the intervener." So this is about aligning our own best practice with what we know we need in the moment, our own mental well-being, our own health, and only from that more aligned and healthy place can we support interventions that are ultimately non-violent. I think part of what you're saying as well really makes me think about the theory and practice of non-violence, right? We're interested in stopping violence on an external level, but that theory of non-violence filters all the way down to the way that we speak to ourselves, to the way that we speak to our colleagues, the non-reactivity that we can bring to any kind of situation. So implementing non-violent interventions at any level, whether that's at the system, at the community, at the individual, starts with non-violence towards ourselves.
And can I add something?
Please.
That was not exactly answering the question, but I wanted to also go about the aspect that medicine and peace are connected in another way, because medicine can be used as a proactive tool of peace building. Health is not only a precondition to react peacefully, but you can also use it. There's the possibility, for example, to structure a health system in a participatory way so that various population groups can actually make decisions together and already build up their own health system, or that a health institution can be governed by people from different communities, or that the medical staff is actually combined by people from different communities. So that can have a peace building element in itself as a proactive component. And also you can, for example, make it as an entry point for mediation. Vaccination campaigns sometimes serve as an entry point of mediations between warring factions. I wanted to add that.
That's really helpful. It kind of segues us into the next question, which is for me to ask you about your global grant work in Burundi. So it's currently doing work around diabetes, hypertension, and cervical cancer. And these are projects that many Rotarians would think of as primarily health projects. How do you make the case to a donor or to a club, and what does it take to shift the narrative about how they see the connection between peace and health?
Thanks for that question. When we were writing the Global Grant Project, we were actually reflecting on these questions, and we were taking the IEP's Institute of Economics and Peace positive peace approach. So I can say it's connected mostly to three topics. So health is connected to equality, in a society that everybody has equal access to resources. Then secondly, it is also that, how is it called? Sorry, I have to look. The high levels of human capital, because if a person doesn't function in a good way, then he cannot participate in society. And we often see that in that very poor context of Burundi. Actually, people are so poor that they prefer to die actually than to take care of the disease, because then they think they're quick and not a burden to their families anymore. And the third aspect is, interestingly, I wouldn't have thought about that before, is good relations with neighbors, because that's a quite traditional society. The health system is not very developed yet, and people resort to traditional practices. So they resort to sorcery also and have kinds of superstitions. So if somebody dies, a sudden death, they might actually accuse their neighbors of having done some witchcraft on them, which causes additional tensions in communities and between families that are actually already living in quite high stress because of poverty. So, so in that way, our project is a peace project because it educates people and tells them if somebody dies, it might have just been a disease and not the sorcery actually the cause. And additional element it touches upon is the free flow of information about medical information. In that case is an important element to it. And also one of the preconditions is a well-functioning government and low levels of corruption. So that is something that is difficult to tackle, but you can tackle it. You can try to tackle it at least within the realm of the project.
Thank you. That's a lot. So I think one of the things that I hear you saying is that health work is actually one of several entry points into peace. It's kind of the foundation of the ways in which you're engaging multifaceted problems in different, quite complex operating environments. But health has been an entry point, particularly around vaccination and,
yes.
and your work with other diseases to support things like better relations with neighbours, low levels of corruption, free flow of information.
Yes, yes. Thank you.
Yeah. I think we got one question, one last question.
Yes, we have one last question. So what would you, Alex, ask a Rotarian in this Peace Park to do, to fund or to think differently about, to genuinely advance the relationship between health, healing and peace?
Yeah, I would start with the bedrock of transform yourself to transform the world. The work that we do on ourselves that connects to healing, that connects to integration, that connects to a sense of wholeness, any healing on any level is a net gain for humanity. And so starting with ourselves and scaling up and scaling out over time is an incredibly important starting point for the work. So I would encourage Rotarians to think of the Rotary motto, service above self, but to think of it alongside the invitation of service with self, or service and self. That the support that we provide to others does not have to be at the expense of ourselves. In fact, the most ethical way of intervening in a system is through the use of ourself and our own well-being. So that would be my invitation to any Rotarians here today. How about you, Eva?
I'm starting from the more broader and financial and practical perspective. So I'd be happy if my project that is ongoing in Burundi, near Baku, would continue to be funded, because in the ongoing project, we know what there are deficits and what is lacking. Secondly, if you want to support health initiatives, it would be interesting if you could support those initiatives that have actually, as I said, a combined staff of several different groups, or have or built in a new governance model, so that if you want to contribute to peace, you could set the project up like that. Also, I want to encourage you to add mental health perspectives into other projects. It can be a health project, but it can also be, for example, a livelihood project, because it showed that especially in war-torn societies, even if you add that mental health aspect into other types of projects, then you have a better outcome. If people have mental health treated, then they can work better together and receive better results in livelihood. And thirdly, actually, I wanted to say the same like you did. Start with yourself and take good care of yourself, because you cannot take care of others unless you're feeling well yourself.
Thank you so much for joining our conversation today. We look forward to hearing more from you.
Thanks, Alex.
Thanks,
Thank
Eva.
you.
Bye. Thank you. Bye.
Bye.